around. You see my fist? Yeah, what about him? He's getting ready to you up.
July 5th, 2011, Fullerton, California. Kelly Thomas, a homeless man, is beaten, clubbed, and tased by the police. He dies 5 days later in the hospital. When security footage of the incident is released the next year, it sparks national outrage. Thomas had schizophrenia, and he was looking for a place to sleep. People with severe mental illness are 16 times more likely to be killed during a police encounter. Is the problem that police aren't trained well enough to handle these situations, or that they shouldn't be involved with them to begin with?
A lot of times when people are in crisis, the last thing they need is lights and sirens and police.
Some U.S. cities are changing their approach, and in many cases, it's actually working. The killing of George Floyd re-sparked a national conversation around the role of police in American society and what their responsibilities should actually be. For decades, police officers have been our first responders to calls involving people in a mental health crisis. And they usually have two options once they get there: take someone to the ER or take them to jail. In fact, 20% of inmates in jail are suffering from a serious mental illness. So now, at this critical moment for the future of policing, American people and governments are asking, how can we fix this? The resulting programs range from simple reform through additional training, all the way to taking police out of mental health situations entirely.
I have an adult son. He's 27. He was diagnosed chronic paranoid schizophrenic.
Janet's son, Matt, frequently lives on the streets of Denver, where he often has interactions with the police.
Sometimes when you talk to him, he has a delayed reaction, so they can take that for being defiant. Just knowing that he was out there and there's a potential for him to come in contact with the police was very scary.
At least 25% of people killed by police have a severe mental illness. Some research suggests that that number could be as high as 50%. This has led some departments to reevaluate their approaches to these situations. In 1988, a Memphis police officer killed a man with a history of mental illness and substance abuse. Community outrage ensued, and Memphis PD responded by creating the country's first Crisis Intervention Team, or CIT. The Crisis Intervention Team model requires that officers receive 40 hours of training related specifically to reducing the lethality of situations involving a mental health crisis. It also trains dispatchers to clearly identify these situations and prioritize sending CIT-trained officers to respond. The model has been adopted by around 15% of law enforcement agencies throughout the U.S., even though its efficacy has been hard to measure. CIT detractors argue that 40 hours of training can't effectively teach someone to de-escalate a mental health crisis. And even with that training, the presence of police alone could further alarm someone already in a crisis. These alleged shortcomings have led some departments to develop programs where police officers team up with paramedics and mental health professionals in what is known as a co-response. In Dallas, Texas, Dr. Marshall Isaacs leads the medical component of a new program called Right Care that does exactly that.
When an individual calls 911, Dallas Fire Rescue dispatches the Right Care unit, which is an unmarked police department Tahoe. The paramedic applies a medical protocol, and then the behavioral health clinician tries to determine if we can provide care and resources at the scene. And the police officer remains to make sure that everybody's safe. If we can better serve individuals who are having behavioral health challenges outside of an ambulance without the use of police car, jails, courts, or hospital emergency departments, then the community as a whole has succeeded.
Right Care is still relatively new, but has reportedly kept 28% of the people they've helped out of jail in the ER. However, some cities are taking it one step further and responding to many mental health situations without any kind of police involvement at all. In Eugene, Oregon, a nonprofit called Cahoots has been around for 30 years and received national attention for its non-police response to mental health crises. They sent out a 2-person team with a medic and a crisis worker in a van. There's no guns, badges, or police cars involved. Cahoots responds to 20% of 911 calls in Eugene and saved their medical system around $4 million in 2018. This model has been adopted in Olympia, Washington, and most recently, Denver, Colorado.
Probably what I'd say is we believe in a continuum. We are not a believer of there's one size that fits all. The STAR response works for a whole set of people where law enforcement response is not needed.
Denver launched the pilot for its non-police response team in June 2020, and they'll run alongside co-response teams the city already has in place.
50% of people in our jails right now have at least 1 or 2 diagnosed mental health conditions. Jail is not the answer, and in fact sets people back even further. So this isn't really about investment, but it's really about doing the right thing for people, getting them the right care at the right time in the right way.
Could mental health first response teams become the norm? It's possible. In the 1950s, in several U.S. cities, police were often the first responders to medical emergencies before we had EMTs. So co-response teams, which are rolling out in Dallas, Columbus, and New York, or non-police responses like we're seeing in Denver, Eugene, Albuquerque, and Portland, might eventually become the standard response to mental health situations. And for a mom like Janet, having a professional team on the street who understands her son's condition would mean a lot.
When people see my son on the streets and he's there for days, he looks disheveled, he looks homeless, he's dirty, that's somebody's son. That could be somebody's daughter. They deserve a right to cohabitate with everybody and live in this community like you and I. And just don't forget that they belong to somebody.
Thanks for watching. For a list of organizations supporting people like Janet's son Matthew, check out the description below. For more stories on criminal justice reform, head over to freethink.com and check out our special, Fixing Justice.